Hi, welcome back to my channel AJ's Kingdom, and we'll get back with the documentation. In the documentation, we have discussed elements, purposes, and the types of nursing records and all. Now we will see what are the actual types of records we are using and what are the full form of the different kinds of documentations and for what purpose we are using. We are going to discuss in this class. Okay, let's move on. Already we have discussed in the topic recording or reporting. The definitions already I have mentioned. So when we speak about the records, there are commonly used records in the hospital setup is patient clinical records that we call it as in a different places in a different names, patient case sheet or patient records or patient documentation, or sometimes even every documentation process is taking place in the computer also. So the first one is patient clinical records and second one is individual staff records. Individual staff records, mostly these kind of individual staff records are maintained at HR department of healthcare setup. And ward records, there are various ward records we will maintain like indent, inventory or condemnation or maybe purchasing or like a procurement. So these kind of ward records also we will maintain in each and every ward. And apart from this, administrative records with educational values, administrative records like the staffs, how many leaves are allotted and how many leaves they are taking, these kind of documents also maintained in the hospital. So the first place occupies in the types of records at healthcare setup is patient clinical records, and second one is individual staff records, ward records, and fourth one is administrative records. So when it comes to the patient or clinical records, we can see common ward records. What are the common ward records we are maintaining at hospital level? So the first one is patient clinical record that already I mentioned. It is a case sheet. It we call it as a case sheet. And second one is staff attendance register. I think in every ward we have seen when we were when we went for practice, we might be seeing every nurse after coming to the ward, just they will sign in the staff attendance record, and staff leave record, and staff patient assignment record, like they are taking in what way, like 3 is to 1 or 1 is to 1. The patient assignment record, this is a different topic, I'll discuss in the later classes. And next one is student attendance. Suppose if it is an educational institution or a medical college, definitely in every ward the nurses or the teachers or the tutors will maintain staff attendance register in the wards. Patient assignment records, ward indent record, already I mentioned. Ward indent record, like daily day-to-day life, what are the things we are indenting, especially indent includes like surgicals and non-surgicals and medications. Again, it is divided into surgicals, non-surgicals, and medications. These are the common things every day. Usually, from the ward we indent to the department of material department. Next one is equipment maintenance record. We every month usually what are the equipments are available in the ward and how many are working, how many got repaired or how many got condemned. These kind of records are very important, especially when the ward is maintaining a expensive equipment. For instance, if a ward is ICU setup, which is having a expensive things like mechanical ventilators or defibrillators and other advanced technology medicines like heart lung machines, and in that cases, definitely person should maintain equipment maintenance record and ward incidents records. This is a other different story. Ward incidents means suppose if any legal problems have happened in the particular department, like any patient attempted suicide or any person attempted homicide or a person committed knowingly unknowingly some kind of deeds or activities, we call it as ward incidents record. And infection surveillance record, I think this is a major aspect is taking place in the day-to-day life and most of the hospitals. Infection surveillance record, ward quality indicator record, and ward dietary supply record, And this ward diet supply record mostly we can see in government hospitals very clearly, because for 20-30 patients at a time they will write like this many patients required normal diet NMD, and the other patients requires maybe specialized diet or restricted diet, like those kind of things are especially we can see in the ward diet in government hospitals. And emergency drugs and crash card record, this is very very important, because especially in emergency departments they are maintaining a crash card which is having a necessary medications for emergency purpose. So we need to maintain, suppose if you utilize any drug for any patients, we need to maintain the documentation and we need to replace the another one in the same place. And the important one is patient admission, discharge and shift record. It is very very important, because soon after patient enters to the ward, we try to maintain the admission record, and when patient has discharged we will write in the discharge record. And sometimes the patient may be shifted to different wards, either surgical ward or to the emergency department or to the ICUs or to critical care or other places, then we need to maintain these kind of records. These are the common ward records we are maintaining. And when we see methods of documentation, how to document, we are saying we are recording, we are writing in the case sheet something and all. So what are the methods of documentation, which methods we can use in which area, which methods we can use in which area, we are going to discuss here. That is about narrative charting. Narrative charting means when you explain so many points about a one patient or about any incident or about any occurrence, it is like elaborate, it is not one and one point answers. So we have some kind of explanation. This kind of charting is very very important in case of incidents. When in some incidents happen, that kind of situation we have to use narrative charting. And sometimes source oriented charting. Suppose source oriented means, suppose when incidents happened, from where you got this information, from this department or from this department, we will write it. That is called source oriented charting. And next one is POC, problem oriented charting. Whenever we are not writing everything, but it is just we are recording related with the problem alone. And next one is PIE charting. This charting also we are going to see in detail in the next class. Problem, PIE charting, focus charting, and charting by exception. Charting by exception means we are recording only important things. We are not writing everything. When you write everything, we call it as a narrative charting. When we write some content which are limited, and that we call it as a charting by exception. And computerized documentation, case management with critical paths. This is also one of the strategy in most of the private hospitals we are seeing. Like suppose this is not working out, then what is the next modality? If this is not working out, this we call it as a case management with critical paths. So these are the different methods of documentation we are using. And in the previous class, previous topic, we have what we have discussed is common ward records. What are the records usually we maintain at ward level is a common ward records. And next one is methods of documentation. And if you want to see in detail methods of documentation, already I have mentioned like narrative charting. Narrative charting, the we call it as a traditional client method. In this method, we will write everything in the case sheet. We will write everything in the case sheet. I think this is very very important when patient has admitted in the hospital. When patient has admitted in the hospital, we need to collect all the family background and his previous injuries, previous accidents and previous illness, childhood illness, and even what kind of medicines he has taken and what kind of situation he has grown. These all types of information we will be putting together. That's we call it as a narrative charting. And there are five basic components of traditional client records are admission sheet. In the admission sheet, most of the time we can see lot of details in that. And physician order sheet and medical history, nurses notes, and special records and reports like referral or x-ray reports. This is all the basic five components of traditional client record. Mostly in that traditional client record, this all details are included. So that is about narrative charting. Next type is source oriented charting. Next one is source oriented charting. Here we can say, already I have mentioned from where we are writing. Suppose it is from HOD, it is from assistant professor, it is from a physician, or it is from technician, it is from nurses. So like this kind of source from where you are getting, and we are separate sections, the data is separately maintained. Suppose I want to see total case sheet, but when I want to see only a temperature chart, I have to go to the nurse's record chart. Then I can see that whether the temperature has raised or decreased. So here you can see explanation. Each person or a department makes a notion in separate sections of the client's chart. So narrative recording by each member of that healthcare team on separate records like diet, medication and discharge incidents like that. And it is a traditional method, and different discipline charts on separate forms. Each, I think you can see this kind of documentation in private hospitals. They tag so many papers in their file. Each file will have speak about which point. Suppose I want to see about what kind of diet he is taking, the nutritionist will write a separate paper. Suppose pharmacist is giving some medications, the pharmacy person will write other chart, and nurse will record the temperature, nurse will give medications. So like the different charts will give a different informations in the separate sections. That's called it as a source oriented charting. Source oriented charting. And third one is problem oriented medical record, POMR, problem oriented medical record. Here the word mostly used is SOAPIER, SOAPIER, SOAPIER or SOAP format. Here we call it as it is a legally used abbreviation, SOAP. Subject to data, subject to data means what patient says or speaks. Object to data means what we observe or see. Suppose the patient is unconscious, or patient is incooperative, or patient is looking dull, or patient is, so when what we notice, we call it as a object to data. Then now we both will mix what patient is telling and what we observe, and we will do assessment that the patient is having, so and so data. Then P means plan. Next, what we have to do, what you are going to do, that's call it as a P plan, and can add to better reflect nursing process. It's so even IER means plan. After plan we have to give implementation, intervention we call it as a, or implementation. Whatever you have planned, patient is telling that I am having pain, you have noticed that he is having a discomfort. Then what intervention you are giving? You are giving a hot water bag, or you are giving a some medication, or you are giving a some massage, or you are applying some oil. What is this is all called interventions. And evaluate, did pain is reduced or not. Evaluate. R means revision. Again, okay, with the massage pain has been reduced, then we have to go with some other medications. That is all called SOPR. It is called problem oriented medical record. This is the commonly nurses follows the pattern. SOAPIER, SOPR. It's a common, that's problem oriented medical record. When we write a nursing care plan, we call it as a POMR only, problem oriented medical record. Next one is PIE charting, problem statement, intervention and evaluation. It's a SOPR. They make it as a little small. Directly they are going with the PIR, problem statement. Okay, he's having pain, what we have to do, whether pain has reduced or not. Let's call it as a PIE, problem statement, intervention and evaluation. Okay, then other method is focus charting. Focus charting, it's called it as, we can see DAR, focus charting, DAR, data, subject to data, object to data, investigations, everything comes as a data. Then what we have to do, action, and what is the response of the patient. Suppose you have noticed the patient is having fever, and you checked with the thermometer he is having a fever. Then Now focus on action, whether you have to give paracetamol tablet or you have to give cold compress or any other responses you want. Then after that is the temperature has reduced or not. DAR, it is not same like PIR, that is PIE. DA are also same, it is data, collecting the data, action and response. DAR, it's called it as a focus charting. And next one, CBA, charting by exception. Here the nurses documents only deviation from the pre-established norms, documents only abnormal or significant findings, avoid lengthy and repetitive. In this charting by exception means already known story, no need of repeating again. What is new? He is a known case of hypertension, but in recent days, hypertension since so many years he took medicines. All those things can be explained in the early charts. But here we explain he is a known case of hypertension and his BP is fluctuating in the recent years. That is called charting by exception. So that's a one method. Next, this all everybody knows computerized documentation. And now, whatever we are documenting, whatever investigations we are doing, whatever medicines we are giving, whatever treatments we are giving, everything is immediately soon after implementation. Just they are entering into the computer. That's called computerized documentation. And another method is case management process. This is a traditional method where whatever we are doing for one patient, especially in ICUs, everything is implemented and everything is recorded in one document. That's called case management process, where the doctors comes or nurses comes, everybody they will document whatever they have done. That's called it as a case management process. So this is all about different methods of documentation. And next we'll see, this is all different types of methods of documentation. Every document has an important value, and this is a very important question, several times asked question, methods of documentation. What way of method we are using for the documentation? Thank you for watching. If you really like my class, please do subscribe and I will give you some more topics like this.